Hi, my name is Melannie, and I am a student nurse here to give an IV medication to while this book. So, first thing I'm going to do is I'm just going to check my doctor order. I see that he is ordered penicillin 2.5 million units because he has cellulitis in his arm after having a bee sting and then scratching it. So we have that, and so we know the purpose, and we know that he's allergic to walnuts. So now that I've done that, I'm going to just do hand hygiene. And I'm going to select out my correct medication, which is penicillin G sodium. And so I'm just going to start by doing my first check, okay? So I see correct patient is verbalized. Correct drug is penicillin G. Correct dose is 2.5 million units. There's 5 million units in here, so we're going to drop half of what we reconstituted, okay? Correct route, it's given an IV. We're going to be giving it in a mini bag, and it says we can give it IV here, and every 6 hours. It's 12 o'clock, so it's due to be given now. And also we're going to be giving it by mini bag. Originally it said SIVA on the MAR, but we ran it past the pharmacy, we checked the PDM, and I suggested to take it, to give it by mini bag so that it'll be more diluted and we'll have more time to intervene if he does have a reaction. So we cleared all of that. We're going to be giving this via mini bag, so I'm just going to check my PDM. I see that we have penicillin G sodium. It is an antibiotic, like I said, to treat that infection that he has on his arm. It can be given by a student nurse, so I'm all good. A usual dose is 2 to 4 million units every 4 to 6 hours, and we're giving 2.5 every 6 hours, so we're good, and IV is a normal route. So for reconstituting, I've decided to reconstitute with 8.2 milliliters of sterile water for a final volume of 10. That way it'll be more diluted than if I just reconstituted it to 5, just because it's one of his first doses, so we're just going to be wanting to give that. And I'm going to be diluting it in 100 milliliters of normal saline for the same reason, and administering that over 30 minutes like it's recommended. And some side effects are an allergic reaction, so any rash, itchiness, and difficulty to breathe. I'm just going to let him know about that. So now that I have that, I'm going to start my reconstituting, okay? So I'm going to select out, I see sterile water, and it's not expired, and I see this is also not expired, so we're working with good medication. I'm going to grab my 10 ml syringe and a blunt fill needle. And so what I'm going to do is I'm going to take my alcohol swab, and I'm going to open that up, and I'm going to swab the top of my sterile water for 30 seconds, and then let it dry to 15. And then I'm going to take my 10 ml syringe out, take my blunt fill needle, and attach those without contaminating either of the hubs. And like we said, we're going to be drawing back 8.2 milliliters of sterile water because that is the orders on the PDM. So I'm just going to insert that into there, flip, draw back, without contaminating. There we go. Now I'm going to recap utilizing the scoop method, just to prevent any sharp injuries and also just keep the hub free and making sure it's not touching the table. Whack out my bubbles. Now I'm just going to recalibrate to exactly 8.2 milliliters. So I see I have 8.2 milliliters of sterile water without any bubbles. And so I'm going to be inserting that into the penicillin. So I'm going to take my alcohol swab, and I'm going to swab the top of this for 30 seconds, and then let it dry for 15. Uncap this, insert my sterile water, and just let some air come back, just because we don't want to have that pressure build up in there and have it explode all over a bunch of people, right? So just going to recap utilizing the scoop method again. Great. Just gonna gently roll this, not too fast, just to make sure that it's nicely reconstituted. I see there's no sediment at the bottom, so now I'm gonna alcohol swab again because having that aseptic technique is just vital here. So I'm gonna be cleaning for 30 seconds and then drying for 15. Of course, for the demo, we don't really have time to do that. And so, since we are drawing up 2.5 million units, that's half of what's in the bottle, we're only going to be drawing up 5 milliliters because the final volume in here is 10 milliliters. And we only want half of the dose. So I'm injecting 5 milliliters and I'm taking out 5 milliliters of medication, because that's half of what's in this bottle, and we only want 2.5 million units instead of 5 million. So, drawing back, black out my bubbles.
And I'm gonna come back to make sure that the IV is the primary is running again.
We're at exactly 5 milliliters of medication.
Here is your call bell. Press it.
And now that I have that, I'm gonna actually make my label now. That's a personal preference of mine. I like to have it during my second check. So my correct patient is verbalized, drug is penicillin, dose is 2.5 million units, which is a volume of 5 ml. We're going to be diluting it in 100 milliliters of normal saline. So we're going to be bringing that to 105 milliliters of medication. Today is October the 20th, 2020. It's 12 o'clock. My name is Melannie Teitsma, Manitoba student nurse year 3, and that's it. So now that I have my label and my medication here, and my med vial, I'm going to be doing my second check. So I see my correct patient is verbalized. Correct drug is penicillin. Correct dose is 2.5 million units. There's 5 million units in this bottle. We reconstituted for a final volume of 10, and then we drew up 5 so we would get that 2.5 million units. Correct route, this is given IV. We already cleared with the pharmacy and with the PDM and with the doctor that we can give this as a mini bag, even though it was originally ordered as a SIVA, so that is more diluted. So it's the correct route. It can be given IV. We're going to be inserting it in a 100 milliliter bag. And correct time, it's every 6 hours, and it's 12 o'clock, so it's due right now, so we're good as far as the time goes. I think I choked on my own saliva. Okay, so now that we have that, I'm going to select out my correct mini bag, and so here's my mini bag of 100 milliliters of normal saline. Like we said, we can insert it into there, and that way we will be more diluted, because allergic reactions with penicillin are super common. So I'm just going to clean the port here for 30 seconds, let it dry for 15. Now I'm going to safely keep that up here so that it's not contaminated by the table, and then I'm going to uncap this and then insert straight on so that it's not perforating the side of the bag, and so we didn't contaminate either end or any part of the syringe there, so that we're keeping that aseptic technique. So now I'm just going to use the scoop method and throw this in the sharps. Just going to gently mix this and make sure all the medication is nicely spread out. And I'm going to attach my label. So take off the sticker. Oh, come on. Okay. Now we have that. So now that I have my medication, I'm going to grab my MAR, a pen, my secondary tubing, and an alcohol swab. And I'm going to take those into the room, but for the sake of the demo, we're already in the room, so I'm just going to take my MAR off the table just to start off, okay? So I'm going to enter the room. Hi, my name is Melannie Teitsma. I'm going to be your student nurse for today. I'm just here to give you your medication, alright? And so I'm just going to, so if you don't mind, first thing we're going to do, can you just state your name for me? And he says, my name is Valdez Vox. I'm like, great. And when were you born, Valdez? October 19, 1990. And so I see that that matches with our MAR, so that's all good. And Valdez, are you allergic to anything? Walnuts. Awesome. That's what we have on here, and that's something that we also would check before in the med room. So we have that allergy check done. And so Valdez, I'm just going to do my final check of the medications up here, and then I'm going to come back to you and kind of explain what I'm giving to you. Okay, Valdez? Thank you. So I'm going to go up here, and I'm going to take my medication, and I'm just going to see I have the correct patient. Valdez Vox. That always makes me giggle. My correct drug is penicillin. My correct dose is 2.5 million units. Like we said, we drew up half of what we reconstituted in the vial, so this is the correct dose, and we inserted it into 100 milliliters of normal saline, so we diluted it, okay? And correct route, IV, this can be given by mini bag. We verified that with the PDM. And every 6 hours, it's 12 o'clock, so it's due right now, so we're going to be giving this medication. So it's at the correct time, everything is okay, we've done all of our checks. So I'm just going to check in with my patient again. So the medication I'm giving you today is penicillin, which is a drug that you probably heard about before. It's used to treat infections, and so when you got that wasp sting and you itched it, it did cause some inflammation in your arm, and so that's why we're giving this to fight off that the infection, okay? And so he kind of understands that, so I'm like, okay, well, there's some side effects to look out for is any itchiness, rash, maybe difficulty to breathe, okay? Anything that would feel like an allergic reaction, okay? Not to scare you or anything, but sometimes these things happen, so I make sure to dilute it so we'll have lots of time to intervene, okay? And so he understands the medication, its purpose. I implied the right to refuse, and he's doing A-okay. So now that I educated him, I'm going to start with the IVs. So I'm just going to check your IV site here if that's okay with all this. And I see his IV site looks great. It's inserted. There's no redness, no swelling. The clamps are open. Everything's open, and it is running at 25 milliliters per hour, and it is normal saline. And that's something that I already checked on the MD order before. That's what we were expecting to see, and the tubing doesn't need to be changed, so we are all good to go here. So now that we've done that check, I'm just going to start setting up my medication. So first thing I'm going to do is hang my bag lower. There we go. Just because we want it lower than that secondary. And then we're going to take an alcohol swab. And we're gonna swab this for 30 seconds and then let it dry for 15. I always like to use the port up here for mini bags so that if I do need to give an IV push, say if he does have a reaction, if he needs a PRN medication, then that's gonna be open and we're not gonna have to make a saline lock and it's just this whole thing, you know? So now that I've cleaned that for 30 seconds and I've let it dry, I'm gonna take my tubing here and I'm going to safely uncap without contaminating. I'm just going to connect those together. And so the way that I like to back prime is the way that I was taught in lab. Some people like it, some people don't, but for me I find that it's more efficient, and I can also make sure that I'm giving the right dose of medication. So I'm just going to unclamp here. And I'm just going to let it back prime. Awesome. And so we have it at about half to 2/3 here. So now that we've back primed, we're going to take this and uncap that. And some medication did spill out there, so in practice, if this was really delicate calculation, we would want to redo that, but in demo, this is very used equipment, so it kind of happens all the time. So I just attached those without contaminating either end, and I'm just going to hang that up here. You always want to make sure to be sterile there. So I'm going to start my secondary. I want my rate to be 210 because that's there's 105 milliliters in here, and we're giving it over half an hour, so you just multiply that by 210. And so the volume to be infused is 105. I do want to call back, and I'm going to confirm my secondary. Yep. And now I'm going to start. So I see it's running at 210 with 105 in there because of that reconstituting. We added 5 milliliters to the 105 bag. So I'm just going to be looking for 3 drops. 1, 2, 3. Okay, so there's 3 drops. So the medication's running. All the ports are open. No kinks. It all looks good. So now I'm just going to check in with the patient. I'm going to be back here in about half an hour once the medication is done infusing, and I'm going to bring a 15 cc flush with me just to make sure that you get the entire dose of medication if necessary, right? So we're just going to be back. I set it to beep so that it will call me back. And now I'm just going to do my last safety check. I see there's no hazards on the floor, the bed's in lowest position, the patient looks very comfortable, and our medication is infusing at the correct rate. So I'm just going to document in my MAR, and I'm going to document on the fluid balance sheet. And now that we have everything documented, we've gone through all of the 10 rights, and we've done the medication that's now infusing. again, we're going to be back in 30 minutes and just make sure everything is okay and your call bells has been reached. You just call me. All right, thank you. Bye.